This is my sister Victoria Sequeira. She's a registered nurse at St. Joseph's Care Group, and she works on the palliative floor at St. Joseph's Hospital. So today we're going to talk a little bit about the palliative population and different methods, barriers, and other things regarding communication with the palliative population. So who would you consider part of the palliative population?
The palliative population, I would say, can be any age. It can be children, adults, elderly, and it's just anybody who is living with a life-limiting illness. You're more focusing on comfort versus aggressive treatments because this is an illness that they're going to have for the rest of their life.
What are the most common communication challenges you face with palliative patients?
With palliative patients, eventually you do get to a point where it's more your patients are unconscious sometimes, not able to verbally tell you what they need. So a big part of at least my nursing would be to look at the other communication methods that they use. So it could be furrowing of the brows, twitching, restlessness.
Yeah.
It can tell you, are they in discomfort? Are they having pain? Are they anxious? You start to look at the person as a whole. You want to look at their body language is the biggest thing. And then I always stress talking to their family as much as possible because, again, they are that person's voice.
You would say the lack of verbal communication with palliative patients is your biggest
It's
challenge.
It is a challenge and it isn't because eventually you become used to the triggers and things to watch for.
Mm-hmm.
So the thing is family. So family knows a patient better than anybody else, right?
Yes.
They become your biggest communication too when that person's no longer communicating.
Probably have a lot of hard conversations with families in
Hard
regards to
conversations, but important conversations.
that. How do you balance honesty with compassion when dealing with discussing difficult topics with family members or patients?
I think honesty and compassion go hand in hand. You have to be honest, and most all patients, I would say, appreciate that. We have a lot of patients who say come from other hospitals who have been dealing with doctors who don't deal with end-of-life care.
Yeah.
And when we start to have these honest conversations with them about their prognosis, they're very thankful.
I wish other healthcare professionals understood better about palliative care.
I think a lot of healthcare professionals have their niche. So you have, let's say doctors at the regional who are really good with acute care, treat.
Yeah.
The problem is that when you have these doctors taking care of patients who have a palliative diagnosis and they are on, a decline,
Yeah.
they're still focused on treatment, where a patient is more focused on, I'm kind of done the fight.
Yeah.
Now what can I do right now to make my life as peaceful as possible, as painless as possible? A lot of healthcare professionals struggle with that switch in their brains because they're used to treatment. The biggest thing is communicating openly and honestly with the patient. What do they want?
Yeah.
And really focusing on what they want and what their needs are versus what you think is right. I
do deal with paramedics occasionally. Paramedics do transfers to palliative units lots. In your experience with paramedics, what do you say are some really good things that paramedics do with palliative care? Some things that can be improved on EMS and palliative care?
I'm going to be honest when I say that the paramedics that come to the hospice unit are wonderful. One of the things that I really appreciate that they do is that they talk to the patients well. So whether they're coming from home, a lot of our patients come from home.
Yeah.
What'll happen is that they talk to them throughout the whole transfer. They're very sweet. They explain the room to them. They say, do you need a blanket? Do you need this? Do you need that? What can I get for you before I go?
Yeah.
They're very, they try to be homey. And I think that's really important because when someone's coming from home to the hospice unit, that's a big deal. To be as warm and just nice to that person as you possibly can and empathetic is the most important thing, and that's all of the paramedics that come to the hospice unit.
Do you have any special techniques when you're trying to communicate with patients that are kind of hesitant to treatment or maybe have a little bit of resist against the healthcare system?
I probably communicate with them the same way I try to communicate with everyone, and that's as lighthearted and personable as possible. So see me as a friend and that they trust what I have to tell them. And I never try to make decisions for them, but I at least try to educate them on every possibility so that because they trust me and they see me as a kind person, they feel comfortable with making what they decide. It's their choice, and I think just promoting a calm, empathetic environment, that's where they can make their own decisions.
So my final question is, what is the one most important thing to remember when you're communicating with a palliative patient or their family?
I think one of the most important things is to always put yourself in that patient and their family's shoes, because this is the hardest thing that they're going to be going through.
Mm-hmm.
And while honesty is very important, you still want to make sure that you have that compassion and that empathy towards their situation,
Yeah.
so that they just feel as supported as possible.
I think the biggest impact paramedics can make overall on palliative care patients.
Just having that empathy and communicating with the person as much as possible, because I think that transition from home to hospital or hospital to hospital is very stressful.
Yeah.
So to ease some of their worries with lighthearted conversation and compassion and empathy for their situation, it goes a long way.